becoming better, so great job. And before I start my presentation, I would like to discuss a podcast that I started a couple of years ago just as a hobby. And I already interviewed 60 of the leading scientists in the aging domain. We are happy to report that we have more than 1 million downloads, and you can view or watch it in your favorite platform, so I encourage it if you want to. And the agenda for today's presentation is to discuss how biotracking leads to action, how InsideTracker has validated it with more than 100,000 users, and now we are leveraging around 15 years of data from free-range humans. So the vision of InsideTracker is to help everyone in the world live better longer, and as you can see, we still have a lot of work to do, but we are running for the long run, so we'll do it. And how do we do that? So we basically collect a lot of information on each user. We are collecting blood data, around 50 blood biomarkers. We are looking at millions of DNA SNPs. We are connecting to a lot of fitness trackers and collecting whatever we can from that. We are asking our users a lot of questionnaires. And right now we added also a nutrition consumption. So basically each user can scan his food for a week. And based on that, we collect a lot of information about him and can provide a lot of value. All of that information going into what you see it as a brain, basically a place that we're running AI analysis that overlay the personal data on top of data from more than 7,000 peer-reviewed scientific publications that are related to health, wellness, longevity, health span. And this platform released to the user a laser-focused clinical insight and a very directed personalized recommendation for the user to follow. So I would like to show you a quick video of how the platform is working. Hopefully it will work.
The InsideTracker app provides a convenient and intuitive dashboard for everything you need to optimize your health. Once your blood results are ready, your personalized analysis will reveal where your health is optimized and where it's not.
Sorry, it's playing, but it's not showing. Sorry about that. Yeah, you need to move. Thank you, Mark.
The InsideTracker app provides a convenient and intuitive dashboard for everything you need to optimize your health. Once your blood results are ready, your personalized analysis will reveal where your health is optimized and where it's not. Each biomarker tab includes a breakdown explaining what each measurement means for your health. Adding DNA results takes your analysis even deeper by revealing how your genetic predispositions are contributing to your blood biomarker levels. Once you select a wellness goal, InsideTracker's algorithm will generate a customizable action plan with specific nutrition, fitness, supplement, and lifestyle recommendations. Explore each recommendation to learn how to improve your biomarker levels and achieve your wellness goal. Easily toggle recommendations on or off to focus on the actions that will make the biggest impact on your health and longevity. Check in each day to track your progress. You can also customize your notification settings to help you stay on track. Integrate your fitness tracker for real-time feedback and pro tips, like how you can best recover from a workout. Retest your blood biomarker levels every 3 to 6 months to track your progress over time and identify what to work on next. Discover the science of your health. InsideTracker. Start inside.
Okay. Yeah. Okay, so in the last year, we were very busy to add more feature to the platform, and I would like to discuss some of them with you today. The first one is a health span DNA-related score. So we developed 10 scores related to health span, and you can see here an example like cognitive aging, epigenetic age-related score, and so on. And you can see that that's actually my result. So you can see that out of the 9 scores that you see here, 6 of them are optimized. I have 2 that are okay, sorry. I have 2 that I'm very good, like I have a tendency to have high mineral density and increased morningness, but one of them are very low. I have actually a very low grip strength. And if you want to check your grip strengths, I've seen that Alex brought a lot of them, so you're welcome to check it. So I used the dynometer to measure my grip strengths, and indeed my grip strength was pretty low. So what I've done, I went to the gym and started to work on that. And again, you can see a way to close the loop and find and direct you to the right intervention, because you have so many interventions. I don't have time in a day to do everything that I can. I need to know what I should do. Another example is what we call a health span habit score. So we collected all the data from a fitness tracker and looking at it in a time span of a week, and showing to the user what activity that he's doing, making him better in health span, and what other activity making him worse. And you can see here an example that in a specific week, my step count was the lowest. So I received 2 interventions, but one of them, the second one, is to take a 30-minute walk after a meal, if possible, to help control your blood sugar. And indeed, my blood sugar is not really optimized. So again, it's personalized for me. And if I will optimize my blood sugar, I can optimize my biological clock that we develop based on blood. So again, a way to direct you to the right intervention and focus you on your activity. I discussed it briefly before. We developed a platform, and actually we worked on it for a few years, of how to collect nutrition consumption, including food and supplement, and basically know exactly what happened with the user. We decided to do it in a time span of a week because people cannot do it forever. And we believe that a week is the right time span. You go to the grocery shop once a week. You're doing differently in a weekend versus weekday. The day that you're working at home is different than the day that you're working in the office and so on. So do it like once a quarter or once a year. And then based on that, we are providing you a lot of information. So we can tell you what macro and micronutrient you consume too much or too little. You can see in the second screen from the left, you can see a snapshot of your week. So in green, you can see your sleep. In yellow, you can see your exercise. The apple is nutrition, and that week I haven't supplemented at all, so you don't see supplement. But basically, you can see a snapshot of your week. Then our ML platform provides you some recommendation about timing. Are you eating too close to sleep, too far from exercise? How long is your intermittent fasting, and so on? Then you can zoom in into specific macro micronutrient, receive some correlation with blood and DNA, and at the end, receive some recommendation what food that you anyway eating in that week, you should eat more in order to improve, in this case, the level of your magnesium. Last but not least, I'm sure that all of you heard about ChatGPT, and you know the advantage and disadvantage of it. So we develop a platform on top of ChatGPT that basically look at specifically on 700 articles that we wrote that curated very carefully by our expert. And then that's allow us to refine the model for health and wellness, so it's much cleaner. And also provide a source, so you receive a recommendation for something, you can see exactly what is the source for that. So now when we discuss a bit about the product, let's discuss about the results. So last year I showed you the data from a paper that we published in 2018. We looked at 1,000 users that tested in baseline and follow-up, and we've seen nice result of improvement. Now we have more than 100,000 users that include not only blood, but now we have DNA, user-generated health data, and fitness tracker input. So let's review for a second what do we have. We have more than 100,000 users with blood and user-generated health data. We have more than 20,000 with repeat blood draw, more than 30,000 with DNA, more than 40,000 with wearable data for over time. If you look at a peer-reviewed scientific publication, we have 2 weeks or 1 week. We have years of fitness tracker data. We have more than 1,000 users with the ChatGPT-like solution, and we just launched it like a couple of weeks ago. So it sounds like our users really like it, and it will increase significantly soon. And we already have hundreds of people with 7 days food and supplement consumption. And again, we haven't launched it. It's still in beta phase. And because we have so many users, we can calculate the biological clock for them. So let's zoom in for the 20,000 plus repeat blood draw, and you can see here how it's the composition of the data set, female versus males, the age, the ethnicity, and the body mass index. And what we decided to do this time, because again, we have more than a decade of data, let's look at the data for over time and try to understand what happened. What happened for a population that follow digital health recommendations such as InsideTracker, and see whether it's improved. We showed it in 2018 and we're showing it again here, but how are we able to continue to maintain it? So you can see here on the left side some data about A1C, glucose, LDL, HSCRP, cortisol, and so on. And in the right side, you can see an expansion of LDL cholesterol, and you can see that they improve from baseline to follow-up and continue to maintain it for the next couple of tests, but in the 5th and the 6th test, they actually improve it even better than the 2nd test. So at least for LDL cholesterol, we can see a correlation between using the InsideTracker platform and continue to improve their blood biomarkers. We also looked at a very small population that started with A1C above 6.5, which considered to be diabetic. It's only 24 users, but they tested 5 times. And I want to mention that the gap between tests is around 270 days. So each of those graphs that I'm showing to you, it's years of data. It's not like 2 weeks. And you can see that, again, they succeed, the diabetic population as well, succeed to improve the blood biomarkers. And in the 5th test, on average, they become pre-diabetic. Another thing that it was interesting for us to test is what is the correlation between polygenic scores and the improvement of a specific blood biomarker. So you can see here an example of LDL, total cholesterol, and ferritin. And you can see 3 buckets, the bucket of above 90% risk, so very high risk, middle risk, and very low risk, below 10%. And you can see that the subpopulation that had the lower risk succeed to improve better the blood biomarker from baseline to follow-up in all of those examples. Last but not least, we decided to try to see and understand what differentiates between improver and non-improver. And by the way, that was a recommendation of Nir Barzilai. I'm not sure that if he's here, but if not, let him know. So Nir suggested, let's try to understand what is the difference, why some people can improve and others don't. And luckily, we had enough data of blood plus physiomarkers to try to understand it. So in the black line, you can see the improver, and in the gray line, you can see the non-improver. And what I'm showing to you here is the amount of steps that they accumulated. So at the beginning of following the test, they accumulate a very similar amount of steps. But with time, the group that improved accumulate more tests than the group that haven't improved. So that can have some population health impact. Basically, the clinician that here can maybe say to their patient, maybe you should accumulate more steps in order to improve your total cholesterol. We also looked at the effect of engagement on improving blood biomarkers. So here you can see a few examples, a biological age calculation, creation of action plan, and connected wearable. And in each of them, you can see a significantly improvement of the blood of some of the blood biomarker following adding the engagement tool, again suggesting that more engagement improve blood biomarkers. So to summarize this manuscript, and basically, by the way, it's submitted by Nimisha Schneider. We looked at a cohort of 20,000 users. We accumulated data of blood, DNA, physio tracker integration. We reproduced the result from 2018, and we had novel insight. First, we demonstrated that the impact of genetic on the ability to improve biomarkers. We verified that biomarker improvement is sustainable for many years and also for more than 5 draws. And it suggests why and how users are able to improve biomarkers. So we can separate between improver and non-improvers. And last but not least, we confirm that platform engagement improve outcomes. So I just want to finish by summarizing all my presentation. What I showed you today is how biotracking leads to action. How InsideTracker has validated this with more than 100,000 users. And now we are leveraging 15 years of data from free-range humans. And last but not least, we are actively looking for partners to enrich this data asset and work with large organizations looking to use data to solve important and real-world problems. Thank you so much.
Thank you very much, Jill. That was really spectacular. Lots and lots of data. Does anybody have any questions they want to ask? There's one back there. Who needs someone with a mic?
Thank you, great presentation. I'm curious about how you track resistance exercise. Obviously, fitness trackers are great at tracking steps and cardio exercise generally, but not so great at tracking the equally important, I would argue, resistance training.
Yeah, it's a great point, and by the way, we are connected with a few fitness trackers, and each of them is different, so there is a lot of dirtiness there, and our data science team working very hard on that. But you have a few ways. A tracker like Whoop, for example, claim that they can do it automatically. With some other tracker like Apple Watch, every time that I'm exercising, I'm tracking it. So it's not very clean as seamless as running and walking, but you can do that.
All right, more questions for Jill?
Okay, actually I'm mic'd up, great. So, huge fan, by the way. Thank you for doing this every year, and great shirt. So you're really gaining muscle. So we should set the trend if you make it sure people see it. So you now have so much data that probably nobody else has this kind of data on people with biomarkers. Do any supplements work? Do you see anything through data that you would like to share with us?
Yeah, so we are analyzing it right now, so I cannot say a lot about that, but yeah, we are looking into that.
NMN, yes or no?
We are not, we are trying to, again, it's a long story, but we are trying not to recommend something that is not validated in human, so we are not recommending NMN.
Thank you.
All right. Thank you so much. That was
in humans.
Thank you very much.